permission. Okay. Now I'm going to share my screen. As soon as I find the right screen to share. There we go. Okay. So you guys, can you see the first PowerPoint?
Yes.
Yes. Okay.
Yeah.
All right. Cool. All right. So what I do is I'm recording these for people who can't come when we're scheduled. They take about 4 to 5 hours to convert into a form I can put on to D2L, but I'm going to put them on there and everybody can re-listen to them as you choose to. So today, oops, some just ditched something in my house. Hold on. I am like gonna be completely, I am got 4 cords here on my computer. Okay, so today we're gonna talk about the urinary system. And the nice thing about the urinary system is you all know a little bit about it because everybody deals with this every single day, multiple times a day. Okay, so for the A and P that we need to know for this, the kidneys. The function of the kidney is to remove waste products from the bloodstream, okay? The ureters. These are tubes that run from the kidney to the bladder to transport urine. Very important job. It has to get from the kidneys to the bladder or we can't get it out of the body, okay? The bladder. The bladder is a muscular organ that holds urine. Yes, it is a muscular organ, okay? Some people would like to say that it is not muscular, but as we get old, that tends to lose some of its elasticity, okay? And the urethra. The urethra is a tube system which carries the urine outside of the body, okay? So urine. Our urine can tell so much about us. I always have said when I was working in the lab, I could look at a urine sample and know if the patient was relatively healthy or if something was wrong. Usually it should be clear, okay? And it'll be anywhere from almost the palest of yellows to gold, depending on the time of day, on how much water we're drinking. It should be free from sediment. It should smell like urine, but not be foul smelling, okay? It'll have a specific gravity within this range, okay? It should be at a pH of 6, okay? These are all things that we can test by doing a dipstick test in the urine, okay? Any changes in these values indicate a disease. There should not be protein in a normal urine sample. There should not be glucose in a normal urine sample. The one thing I do want to point out is that the specific gravity, okay, it is higher in our first morning sample. Now, we don't all, and all patients don't sleep like normal nighttime sleep. We have lots of people who work jobs during the night. So your specific gravity, I say, is usually at its highest after you've been asleep for 4 or 5 hours, okay? With that said, that is one of the reasons that the first urine specimen of the day is used for a pregnancy test, for glucose monitoring, things like that, because since it's denser, okay, we haven't been drinking water overnight, it's denser, we can pick things up at a higher level, okay? So when the specific gravity is high, that means the person is not very well hydrated, okay? When the specific gravity is towards that lower number, that's usually what we see as people drink their normal liquids throughout the day, okay? All right. Common signs and symptoms of danger in the urinary system. Blood in the urine, white cells in the urine, protein, painful. Nocturia means that people have uncontrollable bladder function at night. Oliguria, a lot of urine. Anuria, not producing any urine. And frequency and urgency. So a urinalysis is the easiest test for us to gain information about a patient, because little kids don't mind peeing in a cup, adults don't like it, okay, but they will pee in a cup. People would rather give a urine sample than they would a blood sample, okay, because it's non-invasive, okay. So the urinalysis, again, can tell us a lot about what's going on in somebody's body, okay. They can culture urine. They can, when they do a culture and sensitivity, what they're referring to is if there's bacteria in a patient's urinary system, they are going to test different antibiotics and see which antibiotics the bacteria are sensitive to, okay? Blood tests, the number one test for urinary function is the blood urea nitrogen. So your blood urea nitrogen, or your BUN, is always at a certain level. It can go up a little bit, it can go down a little bit, and we don't notice. But when it is high, that is a prime indicator that the kidneys are not functioning well, okay? Creatinine clearance, we can measure with that. We can do KUB imaging, kidney, urine, or bladder imaging. So if you see KUB, that just means we're taking either x-rays or MRIs or ultrasound scans, some type of scan for the kidneys, the ureter, and the bladder. All right, I'm gonna take a breath. I forget when I'm not in class and I'm not walking around, it doesn't. So if you need me to stop, tell me to stop, okay? Some more diagnostic tests we can use for the urinary system. An intravenous pyelogram that provides a picture of the bladder and the ureters, okay? We can do a cystogram or a cytoscopy. Those are involving the bladder. Remember, CYST involves the bladder, okay? We can do biopsies. We can do catheterizations of the urinary system. Again, not pleasant, but if you have to have it done, you have to have it done. This is just a picture of the cytoscopy procedure. And I have noticed that in most figures regarding the cytoscope and cytoscopy procedure, they do show the male system, and I don't know if that's because it's easier, it's more of a straight shot for us to see. But a cytoscope is inserted in through the ureter, and it has a little light on the end of it, so you can see as it goes from here up through the ureter, okay? It can go into the bladder, and it's very, very flexible, so they can see all the surfaces of the inside of the bladder. Sorry. Okay, so let's start with a urinary tract infection. Okay, this is a very broad diagnosis. It covers infections of the urinary tract system, including the urethra, the bladder, and the kidneys. Okay, most often it's caused by bacteria. It can be fungal. Okay, there can be viruses too, but E. coli is the most common bacteria found in UTIs. Okay. It is more common in females because it is a, how do I want to phrase this? It is more of a lack of good construction in the female's body because the urethra is very short, and both the urethra opening and the vaginal opening and the rectal opening are all in close proximity, okay? Some females have improper toilet habits. One of the things we stress with patients is wipe front to back, not back to front, because when you're wiping back to front, you are bringing all those intestinal germs up towards areas which are not meant to see those germs. Okay. Um, Another reason UTIs are more common is that vaginal secretions can harbor bacteria. Okay. And the vaginal open and the female urethra opening are very close in proximity, whereas male prostatic secretions have an antibacterial effect. Okay. Um, Sexual intercourse can cause trauma to the urethra and bladder, leading to inflammation and infection. I know that it sounds kind of funny, but um, people who are new to having sex often are not quite sure where to put things, and sometimes things get damaged. Okay, so if you are working in an office and someone comes in and they may be a little shy about, saying that they've just had sex for the first time, but things aren't quite right down there, sometimes it's important that we look for signs of trauma. Okay. And I know you're probably all sitting there smiling and giggling, but it happens. Okay. And the last thing is that pregnant females are more susceptible to urinary tract infections because of the pressure of the uterus on the urinary system. So again, diagnosis is by a urinalysis. They pee into a cup and you do a dipstick, and they usually look at it under the microscope and they culture the specimen. Treatment is usually very good success on using antibiotics. If there's fungus in them, they will put somebody on an antifungal. Um, if if a female has a vaginal yeast infection, that yeast can spread to the urinary system. So a lot of times if they find yeast in the urine, they will also recommend that the woman be treated for a yeast infection. Okay, since things are all tend to be in the same general area. Now, let's talk about urethritis. This is inflammation of the ureters. Okay, now this is more common in males. Okay, um, because the urethra in males is longer, so there is more of a chance for things to have a chance to incubate and become infected or inflamed. Okay, urethritis is very common when there's cystitis, or cystitis is another term for inflammation of the bladder. Okay, the symptoms of urethritis are a swelling of the urethra, painful urine. Sometimes the urethra swells so much that people do not urinate at all, and then they have to be catheterized, okay? And there can be urethral discharge. All right, so let's switch to cystitis, inflammation of the bladder, also known as a bladder infection. Again, very common in females when they become sexually active. It used to be called honeymoon cystitis because fluids were being introduced in areas that normally had not had fluids introduced. And because of that, females tended to get UTIs and cystitis. So um, when and that's one of the things that we don't tell women when they become sexually active, that they are very prime to a urinary tract infection. And honeymoon cystitis used to be something that people wouldn't talk about because they were afraid that they were doing something wrong. Okay, so the treatment again for that is usually antibiotics, but another thing that's really important is to give antispasmodic medication, which will decrease the bladder spasms. Okay. So, Peridium is the generic term for it. It's marketed as Urostat, Urostat, and this has been wonderful for urinary tract infections in our country because it used to be you had to have a prescription for this. Nowadays, if you have what you think is a a bladder infection or a urine tract infection, you can go and buy this over the counter and it will really help calm down the bladder from that urge to urine every 5 to 10 minutes, and it will just generally help you feel better. Um, it does cause your urine to turn reddish orange, and it's a weird reddish orange. It will stain the clothing. It will, um, look very odd when it comes out of you, but it is basically like it anesthetizes the inside of your bladder, and it really has provided a lot of um, treatment to women who did not have this over-the-counter option until about 15 years ago. So after the treatment, okay, many doctors will have you return and do another urine culture and sensitivity to determine that you've eliminated the bacteria, but that's not always the case. Pyelitis is inflammation of the kidney pelvis, the renal pelvis. And this results from an ascending infection from the bladder. So usually pyelitis is previewed by a urinary tract infection, which has gone up the ureters, which has gone into the bladder. Now it's working from the bladder into the renal pelvis. Okay, it's working backwards from the elimination process. Okay, this is usually left to an untreated UTI. So if you get a UTI, get it looked at. Okay. So pyelonephritis, it can be due to the ascending infection that we just talked about, or it can be from a hematogenous infection. And this could be something that is an infection that's originating in the blood that the patient is septic from, okay? And it could be getting into the kidneys that way too, okay? So it may affect one or both kidneys. Probably the biggest thing is you will have flank pain, which means your back, the sides of your back hurt. You'll have bloody urine, and you will just have the worst chills and fever going on. Again, this is treated very effectively with antibiotics, but many times the patients have to be hospitalized so that they can get IV antibiotics as opposed to just oral antibiotics because they need a higher dose. Now we're going to get into some diseases of the different anatomical parts of the kidney. Okay, the kidneys contain glomeruli. Okay, and each glomerulus, okay, is a filtering unit of the kidney. So we have thousands of units of these in our kidney. So we have lots of glomerulus, plural is glomeruli. Okay, so if your kidneys aren't filtering, okay, they can become inflamed. If things aren't passing through normally, okay, this is the most common kidney disease that occurs 1 to 4 weeks after a strep infection. So just because we get strep throat and we take our course of antibiotics, we think everything's fine. Every once in a while, the strep will come back up and it will cause kidney disease. Okay, so again, glomerulonephritis. Okay, this is inflammation of the kidneys, of the glomerulus in the kidneys. Okay, it's not suppurative, which means they don't produce pus. So this isn't like an infection that you can see. It's pussy, it looks gross. Okay, this inflammation is a result of the tissue destruction caused by the immune system. There's an antigen-antibody reaction. They don't know why it is this way instead of a regular looking infection, but it is very destructive very quickly, which is why they try to get kidney infections treated very quickly. Okay. Again, acute glomerulonephritis. You're going to have that side pain, side back pain, fever, loss of appetite, malaise, you're going to get swollen because your kidneys aren't processing out as much urine. They're not processing out the extra water out of your system. So your eyes are going to start to get swollen. Your ankles are going to get swollen. You may have a lot of urine or oliguria, and most definitely because of the inflammation and the antigen antibody reaction, you're going to probably have blood in your urine. Okay. Again, prompt and proper antibiotic treatment for strep infections. Most 99.9% of the time, it's a strep infection. And so they are really, really, really trying to get on that as soon as they can figure that out. The opposite of an acute glomerulonephritis infection is a chronic one, okay? And this is what happens when the patient just has repeated bouts of acute glomerulonephritis. I just can't get that word out today, okay? These acute attacks can lead to hypertension, okay? So because the kidneys filter out the water. Water helps us modify our blood pressure, okay? So when there are repeated bouts of the acute phase, it causes a hypertension. This hypertension causes a lot more negative feedback within the system, and it becomes just a chronic problem for people, okay? A lot of times they'll have blood during the late stages of this problem. And again, they try to control the hypertension. They can do that with water pills to try to get some extra water out that way. They can try to really watch the diet, okay? If it does not get better or the symptoms don't cool down enough for the patient to live a normal life, they may require hemodialysis or a kidney transplant because of this infection. Hydronephrosis. Now, I never have problems saying this word, but that glomeruli thing just always gets me. So hydronephrosis, this is urine in the renal pelvis. And again, the renal pelvis is the area where the kidneys start draining into the bladder. Okay, I'm going to show you on the next picture. Okay, so we've got the normal kidney here on the right, a normal ureter, okay, and here's our bladder, okay. So with hydronephrosis, there is something impinging the ureter somewhere, okay. So all of that fluid backs up and it makes the kidney blow up, okay. So it takes what I always say is it's like shoving the air from a balloon all to one end of the balloon, and eventually it's going to pop, okay. So that is one thing when patients come in and say that they cannot urinate, it is dealt with very quickly, okay, because you have to figure out the why, because the last thing you want to do is have a kidney that ruptures, okay. Now I'm going to go back. So it is diagnosed by a pyelogram, okay. The treatment is they will drain the kidney pelvis by surgery. They can get in there, get that extra liquid out, and as they drain the renal pelvis, any more urine that's coming into that kidney is just going to keep draining out of it. But the most important thing is to find the obstruction and provide relief of that obstruction, okay. So again, your normal kidney, your hydronephrotic kidney. Kidney stones. Let's switch gears here. Kidney stones, renal calculi. They usually form in the renal pelvis. Okay, so if I go back to the previous slide again, okay, the renal pelvis is this area where the kidney and ureter meet. Okay, the kidney and the ureter meet. So this area is prime for kidney stones. Symptoms: blood in urine. Kidney stones tend to be jagged, okay? as they are leaving your renal pelvis, they are cutting things, catching the sides of things, which is why they tend to become, they make things bleed. Okay. So again, the other symptoms are patients will come in, they will tell you it's the worst pain I've ever had in my life. Okay. Extreme spasmodic flank pain. Their pain just is horrible in their flanks. Okay. And their sides. Um, I have had women who've had babies come in and say, this is worse than labor pains. I'm not sure what's going on. Okay. So the renal calculi can go, they start right here in the renal pelvis. Okay. They can get stuck in the ureter. They can make their way, if they're small enough, okay, and get stuck in the bladder. Okay. And they can get stuck in the urethra. So diagnosing them, okay, and passing them are two different things. Okay. So one of the things that um, they now can do is apply radio frequency waves through the back, through the skin of the back. They just put a machine on the back, and it hopefully the radio frequency waves break these big stones down into tinier stones so that they pass very easily through the ureter and through the bladder and through the urethra. Okay. They do two other things for when for non-surgical removal of renal calculi. They will give the patients Flomax, which is a medicine that opens your ureters wide open, okay? And they will also over or superhydrate the patients. So between giving them Flomax and drinking, or if they're in the hospital, they'll just put them on an IV bag wide open. That hopefully flushes out the smaller stones and they can get rid of them. Okay. Oops, hold on 1 second here. So, obviously the diagnosis is made by an IVP, a KUB, and remember a KUB is a kidney ureter bladder picture. They can do renal ultrasounds. Okay, so they're going to give the person pain medicine, increase that fluid intake. Lithotripsy, that was the procedure where I was talking about the radio waves going through the skin in the back to try to break the stones down smaller. Now, if they can't get the stones small enough, they're going to have to go in and surgically remove them. Okay. We also prefer, if it's the first couple times someone's passing a kidney stones, they want them to strain their urine and keep the stones. They will send those stones to the lab to be analyzed for what compounds are making up the stones, because then they can hope to adjust the diet of the patient. Okay. So that is one of the ways they can do that. By adjusting diet, they can change the increase, they can decrease the frequency with which patients actually make the stones. Okay. All right, polycystic disease, polycystic kidney disease. This is an inherited disease, okay? It causes enlargements of the kidney due to grape-like cysts that grow on the outside. It's a very slow progressive disease. The symptoms are lumbar pain, blood in the urine, recurrent UTIs. What they usually do is they usually find out, that's when the history of a patient comes really into play. Yeah, one of my parents had polycystic disease. Okay, that's going to point them in the right direction. They'll do scans, they'll do different blood tests, some urine tests, and figure out, okay, do they have the same thing? So the treatment is managing hypertension, okay, and the urinary tract infections. Those are the first couple treatments that they can do. The second treatment, stages of treatment, would be dialysis and kidney transplant, when the kidney starts being taken over by the cysts so that the kidney stops functioning. Renal failure. This is when there's a complete failure of the kidney to cleanse the blood of waste products. Okay, it can be acute due to a urinary tract infection or a trauma, or it can be chronic. Okay, it can occur on a regular basis. Usually, patients don't realize this until about 75% of the kidney function is destroyed. Now, if somebody has, you know, polycystic disease, or they have something else going on with their kidney that they know they've had a chronic kidney problem, they're going to be more likely, the doctor's going to be more likely to monitor if the patient's going into renal failure. Okay. But again, renal failure is when 25% of the kidney is working or less. So 75% of the kidney has been destroyed. Okay. So you're going to have all the symptoms of what's going on with the kidney failure, plus females will become infertile. Impotence can occur. You can get bone weakness, a lot of fractures. And the primary diagnosis for this is just monitoring a patient's blood creatinine and BUN, blood urea nitrogen. Treatment, hopefully they can find the cause of the failure and fix it, but if not, then it becomes a matter of limiting sodium and protein, measuring intake and output. You can give antihypertensives for the high blood pressure, diuretics to alleviate some of the extra water, antibiotics. And again, long term for this would end up putting the patient on dialysis and sending them for a kidney transplant. Kidney cancer. Cancer of the kidney is almost always caused by adenocarcinoma. Okay. It frequently metastasizes to the liver, the brain, or the bone before symptoms appear. You don't hear of a lot of people have kidney cancer. It's not a real prevalent cancer, okay? And a lot of times they just think they have a urinary tract infection. They just think they have continual urinary tract infections. So again, they may have no pain, but they may have blood in their urine. So that's one of the reasons we always ask somebody, when you're urinating, does the color look normal? They may or may not have flank pain. They may or may not have a fever. Kidney cancer is very quiet. It's a very quiet onset, okay? The treatment for it, they can do a nephrectomy, they can remove part of it, chemotherapy, radiation. They don't think there's anything you can do to prevent kidney cancer. Now, they think aka the powers that be, it's helpful to control your risk factors, okay? But kidney cancer may be one of the ones that you just have no say in whether or not you're going to ever get it. But the nice thing is it's not very prevalent. Urinary incontinence. This is termed loss of urine flow control, okay? It is common in females, okay, especially during pregnancy, and it's especially common in individuals 65 and older. There are 3 types of urinary incontinence, okay? Stress. Stress can be from another problem in your body. It can be a mental problem or a physical problem. When stress happens, there are studies that have shown we hold our stomach muscles real tight. And so sometimes when the muscles have to let go, the bladder lets go too. Okay. It can be a problem with urge, that there's continual urges, and that could be because it does not empty completely, the bladder doesn't empty completely, or it could be because of overflow. We just are producing too much urine. Okay. Diagnosis is done by urinalysis. We can do a CBC just to make sure there's no infection. Urodynamic testing and post-void residual volumes. Those tests involve putting a certain amount in and then counting how much comes out to see if they're pretty comparable. If not, they know there's a problem, not with the intake, but with the output. And treatment really depends on the type of incontinence. Um, Many people who have stress incontinence have learned behavioral techniques. There are medications we can give patients to decrease the amount of urine they're putting out maybe at night if it's just a nocturnal problem. There are some medical devices, some therapeutic interventions and surgeries. But another thing that's really nice is there are also tons of over-the-counter bladder um, products that can be used now, which are not bulky. It used to be if somebody had urinary incontinence and they went for some type of adult diaper product, they were very bulky. You could tell somebody was using them. Now they're much more discreet, which is really, really, really nice. So, bladder cancer or transitional cell carcinoma of the bladder, okay? Um, It usually happens when the neoplasms settle into the lining of the bladder, okay? For some reason, we see it mostly in males over 60. The risk factor, the biggest risk factor is cigarette smoking, okay? They will diagnose it by cytoscopy and biopsy. Treatment, it depends on the stages of the tumor. They may be able to take the tumor out through the urethra. They may have to do a radical cystectomy, um, in which case then the patient, they will route the patient's urine through a bag transabdominally. The last thing we always talk about um, are trauma injuries to this area. The urinary system is affected by straddle injuries, okay? And I think when we think of a straddle injury, um, we like to think of something, we're doing something stupid and an accident happens. Um, it is usually because the urethra is injured. Of course, this is more common in males because this is one of the few times that the male anatomy is at a bigger disadvantage than the female anatomy because a lot of the male anatomy is external. Okay, these accidents happen when people are walking a fence or a beam. They're riding a horse or a motorcycle or a bicycle, okay, and they have to suddenly stop and there's a jerk in that general area. Um, these injuries can be very painful, okay, they can be very common. Um, and it is important if the injury occurs that the patient go to the ER immediately and not wait, okay? Another thing is neurogenic bladder, okay? This is a dysfunction of the bladder related to the nervous system. Remember, we have to tell ourselves to go to the bathroom. The bladder sends a signal to the brain, your bladder's full, go to the bathroom and empty it. If there's a spinal cord injury, um, it could come from a motor vehicle accident, it could come from an injury, a sports injury, any type of spinal cord injury, a stroke, okay, a herniated disc, diabetes. These are all non-physical things that happen where the the connection between the bladder and the brain telling it to empty gets cut off somehow, okay? Couple rare diseases. Goodpasture syndrome. This is an autoimmune disorder characterized by glomerulonephritis and pulmonary hemorrhage. Okay. There's interstitial cystitis. This is this is a really, really rough one. This is non-bacterial inflammation to the bladder due to the inner lining of the bladder. Okay, so if the inner lining of the bladder is very inflamed, okay, but there's no bacterial cause for it, it's really hard to treat and diagnose this one. Again, we always end with the effects of aging, and urinary incontinence is the most common problem in our older population. Okay, it's frustrating for them, it's embarrassing for them. Sometimes, no matter what they do, it won't go away. I know that I have people in my family who, have trouble at night. The older people who have trouble at night, they've tried 3 or 4 different medicines and it still doesn't work. Okay. Um, it can impede what they do socially. So we want them to seek out assistance for urinary incontinence because we don't want them to stay at home for fear that when they go out, they're going to be missing something, that type of thing. Sorry, my phone's ringing. Prostatic hypertrophy. This happens in older males. It is when, I hate home phones. Hold on, I'm going to get that because now the answering machine's going to kick on, I bet. Oh, good. Oh, yeah, it did. Hold on. Please leave a message speaking clearly, and we will return the call as soon as possible. Thank you. Okay, sorry about that. Prostatic hypertrophy. Okay, this occurs in older males. The prostate is enlarged, okay, and it can impede on the ureters for dribbling, frequency, pain, burning, and difficult starting urine flow. So that is the urinary system. So let me know if you guys need anything. I did get chapter 14 recorded and it is posted on the content of this week for D2L, and we will cover chapter 15 next Tuesday. Okay?
Okay.
All right, everybody. Let me know if you need anything.
Thank you.
Thank you.
You're welcome.